to the Kapoor, you're ready whenever you can start no problem.
Namaskar, good morning. Om Jai Mataji, Jai Shri Krishna and Jai Shri Radhe. Radha Ashmi is coming soon. आइए सीधा बैठिए. Next is spine straight, shoulder behind, मन set, आंखें बंद. ध्यान मुद्रा में बैठ कर लंबा गहरा सांस लेंगे नाक से और मुंह से 3 बार पवित्र नाम ओम का उच्चारण करेंगे. Om Bhurbhuva Swaha Tasaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yona Prachodayat. Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pashantu Ma Kashchit Dukh Bhagave. Om Shanti Shanti Shanti. Let's all pray to Almighty for the wellness of whole universe. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, or financial. With these good thoughts, we'll start our session of yoga. Om Shanti, Shanti, Shanti. Okay. Your surprise is today a very important topic. Cramps in the legs. Am I right? Most of us suffering, whatever health you are. सभी को ये तकलीफ है cramps की. Suddenly you get cramp. The muscle you don't want to contract and they are contracting themselves. Suddenly there is tightening up, and unfortunately this happens when we are in the bed at night. I don't know how many people are suffering. I'm suffering quite a lot. So this is what is cramp. Most of the time they comes in the legs, at the calf region, the back of your leg, you know, calf region. Sometimes it comes in the small muscles of your feet also. This is very common problem. Why this is happening? Some are not getting, why I am getting. So many reasons. And again, there are so many causes. Why it happened, sometimes we don't know. It is coming, cause is not known. But in other conditions, we know, like if we have other problems in the body, then they come because of those problems. Those are, first of all, is your dehydration, lack of water in the body, which is giving us many problems. You have already heard many times, dehydration is giving us diabetes, hypertension, low blood pressure, obesity, fits and convulsion, vertigo, so many problems. So the cramp is also one of them. Because of dehydration, people are getting this. Other thing is, you know, people who are walking for a long time, especially in the hot weather, when they go out, they sweat a lot, and there is many minerals which are lost because of that sweat. Like you are losing your sodium, potassium, magnesium, calcium, and you're getting cramp. So these are the reasons. Overexertion of your muscles. Other condition which can lead it is many diseases like your kidney problem. People who have kidney problem, either they are having lack of water or over retention of water in the body. You know, when the kidney is damaged, there can be retention. And the same thing happens when we have fatty liver, cirrhosis of liver. Retention of fluid, your stomach is blown up completely. At the late stages, when the liver goes, your stomach comes down. That's a lot of water in your stomach. In the medical term, we call it ascites, which is a very dangerous symptom. So we get cramps then also. And then there are other things like, you know, when we are young, we had our periods. We used to get cramps, remember? Some of us got a lot of cramps. Our uterus, the womb, बच्चेदानी में contraction होती है, जिससे आपका blood flow निकलता है बाहर आता है blood. वो भी cramp की वजह से, constriction. When it happened too much, give you cramp. Wherever you're squeezing of the muscles, cramp will come. During pregnancy, you know, when we were pregnant, we had cramps in our legs quite a lot. Yes. Again, there were so many reasons. Not drinking enough water, and there is too much pressure because of increased pressure in your abdomen. Then there are other conditions like our thyroid gland here. There are two lobes, isthmus in between, junction you can say, or bridge in between, two lobes of thyroid gland here, and four small lobes behind the thyroid gland. When they are not functioning, people suffering from underactive thyroid, we call it myxedema. And that happens with various other symptoms also. At this age, this is very common. In the seniors, we get underactive thyroid, and there are so many symptoms. One is cramp, other one is dryness of skin, depression, loss of hair, you feel very cold. The other condition is those small lobes of parathyroid, which are behind the thyroid gland, because they control our calcium metabolism. When they are not functioning, you get this problem. And other thing is sometimes, you know, when the diabetics suffer more than others. Why? Because they have nerve problem. The complication of diabetes, you have three things, as you know. Blindness, we call it retinopathy, diabetic retinopathy. Then comes your kidney damage, nephropathy, and then the nerves are damaged. That's why these people are getting more cramps, because of the nerve problem. Peripheral nerves are not working because there's so much sugar there, which is causing this problem. So diabetes are more prone to get cramps. They are having a rough time at night, diabetes. Then other thing is smoking. We don't smoke, why should we worry? And excess alcohol, we don't drink. We drink only tea. Again, not too much tea or coffee. You have to control that also. So these are the very common causes. Another thing which is very important, which is applicable to us, hamara upvas karna, fasting. If you do fasting, like you have Monday fast for Shivji Bhagwan, Tuesday Hanuman Ji, you are not taking enough water, you are not taking food, you will be having cramps. And we all have experienced that. Too much fasting can lead to cramps. So please try to do fasting wisely. I am one of them. I used to have fast many years when I was in India working in hospital. Monday fast, Tuesday fast, and the cramps are coming. And then my consultant told me, what are you doing? You will have fast, plus you're working and you have to work for 24 hours. So please watch out your fast. This is applicable to us. Most of us are doing fast. But watch your age, your physical condition before you do any fast. And please, please get the advice of your physician if you are doing fasting. This is my humble request to you. So watch out your system. So these things are happening. Very easy to control. Now these cramps are happening in all the ages. The growing children, they are getting cramps. Why? You know, what is the basic cause for this is our muscles and tendons, they get shrunken up. And in a child, they are not growing at the same rate as their bones. That's why we call it growing pain, and they get cramp-like symptom. Yes, in children also we see this. And then middle age you see, but this is far more common in old age. After the age of 60, 1 in 3 is suffering from night cramps. And after the age of 80, some are already touching or already touched 80 years, 1 in 2, so common. Suddenly you get this cramp, and again, in some people, this cramp comes for short time, maybe few seconds, can be few minutes, and in some happening 24 hours. That is very dangerous. You have to look after yourself. Now I told you the reason, so we have to work according to those causes. What is causing this? We don't know why it's happening. So we will do all our physical exercise, the stretching exercise. Here the legs are involved, not the arms. So we do a lot of stretching exercise of our leg, which I will be showing you in a minute, which one to do. And most of us can do. We are very gentle with ourselves. So this is known as cramps. You can get better by doing these physical exercises, giving more attention to your legs, and you can get better. Try to do those exercises if you're suffering 2 to 3 times a day. And before going to bed, you should do once. That is more than enough. So this is very, very important. Watch out how much you are drinking. Drink a lot of water, be hydrated. And usually, unless it's a very serious problem, there is no medicine. There is only one medicine known as quinine. But again, the GPs are very careful using this drug. They give you very small amount for short time, and then they stop. Like they give you for 3 months, then they stop and they see if your cramps have stopped. And if they come back, they might repeat, but they are very conscious about it. They don't want to use this drug too much, known as quinine. So this is what all about. Main attention is on our stretching exercises. And second one is how we sleep. That is very important. Sleep, how we sleep. I will show you all that, how to sleep to prevent these cramps. Cramps is affected many people. Many people. And again, how we walk, how we sleep, how we walk, what we can do in our bed not to get that. Okay, let's start some gentle warming up exercises, and then we will be doing our yoga poses also we will be doing, and spending more time on those exercises, which is going to help us. Okay, my dear friends, we are ready. We'll do some warming up while sitting. Very easy. Stretch your arm. And you can stretch your legs also while sitting on the chair. Stretch your leg. Stretch your leg. You can touch the ground with your feet and stretch. Stretch. And at the same time, we are going to start our pranayama, Bhastrika Pranayama. Breathing in, breathing out at your own pace, 2.5 seconds in and out, or maybe longer if you are practicing. 4 seconds, 5 seconds. Arms are going up, I am breathing in. And I am, as sitting towards the end of my chair, pressing my feet down on the ground. And feel what is happening. The calf muscle, the muscle which is behind your leg, are getting tight when you're touching the ground very tightly. Do at your own pace. Press hard down on the ground. Well done. Take it back. Now on the side. Again, you are just pressing with your soul, you know. Press the ground. This is affecting many parts of your body. Even your knees, your ankles. Press, stretch only, stretching. Nothing else we have to do. Same thing I do while you're doing upper arm. We want to activate ourselves. Breathe in and breathe out at your own pace. No rush. Carry on. And again, you can do your hands also. They're getting a lot of problem there. Luckily, cramp doesn't come on the upper part of the body. Only the legs, they are the sufferer. Because they carry the whole weight of the body. Open and close. Go on breathing in and out. Well done. Carry on. Then do like this. Down. You are pressing your feet on the ground. Pressing. Double action. Then you can do like this. Well done. And do like this. Only increasing the circulation in my upper arm, which is going to activate me. You can do your laughter also. Laughter is the best medicine. Well done. Do clapping to activate the whole body. The brain, get rid of dementia, anger, greed, sleeplessness, insomnia. Carry on. Be happy and cheerful. Life is too short. Live for the present. Past is dead and gone. Future we don't know. Future we don't know. Well done. Good for the digestive system. For the heart and lungs. Lose weight. Big problem. Overweight, obesity. Carry on. I can see you. Come on, carry on. Carry on. This is your Bhadrika going on. Strong Bhadrika. And you can do dancing of your legs, you know. Come on. Do like this and go on. Today the legs are most important to get rid of cramps. Breathe in, breathe out. Breathe in, breathe out. Warming up nicely. Come on. Well done. See, in the morning when we get up, we are so lazy. So do these exercises. Do Anulom Vilom. Do physical exercise and get active. Now you're quite active, so we'll start giving more concentration to our legs now. Leg exercises. While standing, you can stand or sit on the chair, whatever you want to do. Because I want to stretch my leg, stand on the ground. Again, press your feet down, hard on your mat or on the carpet. Yes, press hard. Press hard. Press hard. On the press hard. Stand erect. Hands by the side. Yes. And press hard. Well done. Next thing is, you are sort of, get hold of the chair next to you so that you don't have a fall. We are walking on our heel. We are walking on our heel. See? We are walking on our heel. Make sure the room is adequate. You can go back walking on your heel. Make sure you have got a spot next to you. Don't have a fall. Yes, standing on your heel. See how much pressure is coming on the calf muscle. These muscles, they are the ones. So, you stand on your heel. Stand on your heel. Walk on your heel. This is good for your knee joint also. I'm doing very slow. Go back on the heel. Very good. Very good. Now again, keep a chair nearby. We are doing our exercises with the multiple benefits. Not only for the cramps, you will see the effect on your knees also. Take your right foot in front, left is behind. This we do for the knee also, you might have seen before. Now bend your right knee and the left leg is stretched out and you're feeling so much work on your calf muscle, these muscles. They're getting tight. That's why you stretch. Bend your right knee. Both the feet are on the ground. Yes? Very good. Follow your body. Stay there for a short time. You can do your Bhadraka Pranayama. Enjoy every step. Go on doing your chanting inside. Concentrate on the calf muscle. And this is going to improve my lymphatic system also, to give me immunity. Plus increase the circulation, get rid of varicose veins even. The pain in the legs, the cramps in the leg. Then you breathe out, reverse. My left foot is front. The right leg is behind, wide gap between the two. Have a wide gap. Now bend your left knee. How much stretch is coming on your now right calf? Back muscle of your right leg. Stay there for a short time. Maybe 30 seconds, 40, 50. When you are doing this practice, stay for maybe 1 to 2 minutes. Put on nice bhajan. Or do your own chanting, even loud chanting. Well done. Now again, the right foot is in front, left is behind, adequate gap between the two. Now bend your right knee. Now here, bend the left knee also. So your sole of the left foot is going up. You are on your tiptoes, forefoot. Bend, bend, bend. Feel the pressure on both the calf muscles. Go on doing your Kapalbhati or Bhadrika, whatever you prefer. Keeping in mind all the precautions of Kapalbhati. Then you come up slowly, reverse. The left foot is in front. Yes. Right leg has gone back. Wide gap. Bend both the knees. And I am on my right foot on the forefoot, tiptoe of right. The left foot is on the ground. Go down more. Go down more. Give more pressure on your calf muscles. Get rid of this cramp, which is spoiling my sleep. It is miserable because the contraction is so much. You feel so bad when it's happening. Best thing is do massage and maybe do stretching exercise even when you are in the bed. Then you come up. These are the one. The next one is very easy. You can do at the back of the chair or you can do on the wall. Okay, I'm first showing. Take your body away. Your feet are about 1.5 feet to 2 feet apart from your chair. Now bend over. See, like this. Bend over. See how much pressure is coming on the calf muscle. Just bend. This is the way the people who are very fragile, they have not good balance. They can do themselves. This is happening in the middle of the night. And if you are sleeping alone, there is nobody to help you. Until then you scream. Come down like this more. See the pressure. Okay, the next you can do against the wall. If you can see me. Yes. This is my wall. I am 2 feet away. Like this, you can see better. Yes. 2 feet away. And I am bending. See? Stay there. Stretching my calf muscles. With the age, they have got shrunken, small. They're getting small. That's why I'm getting cramp. Stay like this. Feet are on the ground. Feet are touching the ground. Just I'm bending my trunk. Arms are touching the wall. This is very good exercise. Carry on. If you can't go to the wall, you can get hold of your chair. Okay. Now other exercises are stretching while lying down. So you can lie down if you can. You are doing this exercise every day. Every day you are doing these exercises. Lie down. Just relax. Cool down. Just relax. Go on breathing from the nostril. Breathe out. Either from the mouth or the nostril. Cool down. No rush.
नो वॉइस
This is a yoga practice.
वॉइस
Yoga
नहीं आ रही.
Hello? You want to know something? Who's talking, please? Okay, now everybody is lying down.
आवाज नहीं आ रही आपकी, बहुत कम आ रही है.
अच्छा, चलो अभी करते हैं इंक्रीज इसको. अब आ रही है?
नहीं.
तो मेरे को क्या पता फिर क्यों नहीं आ रही.
नहीं आ रही है, आपकी आवाज तो आ रही है.
We
अब
can
आ रही
hear
है?
you.
आपकी आवाज आ रही है, उनका ऑफ होगा.
ओके.
Your sound is very good.
Your voice is
मेरी
very
आवाज आ रही
clear.
है?
I think it's
Clear voice, Dr.
just
Kapoor.
carry on. I think I hear you.
Just carry.
Okay.
मैं देखो तो
Just
मेरा
carry
तो
on.
फुल है. iPad फुल है वॉइस पे.
Yeah.
बिल्कुल
Yeah,
आवाज
just
नहीं
carry
आ
on.
रही.
I think it's okay. Yeah. No. We can hear you clearly.
Your computer, nothing to do with you at all.
Yeah.
We can hear you
Yeah.
perfectly well.
So just carry on, Dr. Kapoor. Just carry on.
अब आवाज आ रही है आपको?
हाँ
नहीं,
जी,
कम
आपकी आवाज
है.
है.
ओके देन बाकी प्लीज आप म्यूट कर लीजिए आप अपने आप को. एंड वी आर ऑन आवर बैक. डू एज मच योर बॉडी अलाउज यू. एंड आई थिंक द पर्सन हु इज ऑन द सोफा, आर यू कंफर्टेबल माय डियर? द लेडी लता, Naveen, are you comfortable like that? I think you will hurt your neck. Try to come down more, down on your sofa. You can stay on the sofa if you want. Come down more down. Otherwise, you'll getting a lot of pressure on your neck. Okay. You can come down more on your sofa. Make your head low. And if there's any problem, put a very thin cushion underneath your neck and head. Okay, dear, that's fine. You're all lying down nicely. Enjoy yourself. Don't go to sleep, but. We are lying down. Again, try to relax. Try to touch the ground with the whole body. Whole body. Press. Then breathe in, raise your leg up about 30 degrees. Now I am working with the people with all the capabilities who have got problem with your lower limb, the joint problem. 30 degrees we are holding still. Hold it and stretch. Bring your feet towards facing your face or your chest. That is the idea. Don't let the feet go down. We call it flexing. Extension. Stretch your feet. Your upper part of your feet is facing towards you.
We have to put cushion where under our waist or hips.
Pardon?
We have to place that cushion where.
Who is saying?
No, just carry on what Dr. Kapoor is doing. Please just follow her. No cushion underneath
Please
your leg.
carry on.
Just underneath your head, please.
Follow your own body. Do as much you can do. You can do your own variations. So we are at 30 degrees on the right leg, known as Uttan Padasana. Now I am getting on better. I'm going to go up more. 30 to 40, 40 to 50, 60, and I'm coming to 90 degrees. And I can hold my knee at the back. Now my soul is facing the ceiling. giving more stretch on my calf muscles. My soul is facing the ceiling. Hold it. 30 seconds, 40 seconds, 1 minute even. Carry on. These are all stretching exercises for the lower leg. Hold it. Hold it 90 degrees. Soul is facing the ceiling. Then while exhaling, bring your leg down very slowly. No rush. Very slowly. Now breathe in. Take the left leg up about 30 degrees. Hold it there. Stretch again. Make your feet tight. Take it up 40, 50, 60, 70, 80, 90. And you can hold the back of your knee if there's a knee problem. Oh, you're very fragile. Hold it. Hold it. And give stress on your feet so that my soul is facing the ceiling. Stay there, do your prayers. Oh, oh, oh. Then take it down very slowly. While exhaling, your pranayama is going on side by side. Now, if you are not having brittle bones, no heart problem, no hypertension, raise both the legs up slowly, 30, 40, 50, 60, 90. Hold it, hold. Hold it. Hold. Take your legs as far behind. People do Sarvangasana, that is your shoulder stand. We can't do it. We are not going to do it even. The legs come right down more and you are standing on your shoulder. That is not for us. Don't push yourself. This is more than enough. Hold it for 1 minute. Hold. Then breathe out and take your legs down very, very slowly. Very, very slowly. Fine. Relax again. Take a couple of deep breaths in and out. Cool down. Again, raise your right leg up. Do rotation. And then try to stretch your feet also. And your full attention is on your calf muscles. Rotation 360 degree. Big zero. Clockwise. Carry on. Do 5 times, 10 times, 20 times. Follow your body. Carry on. Full rotation without touching the ground. Up, down, sideways. Then do anti-clockwise, reverse. We are all doing these exercises. But your mind is today at your calf muscles all the time. So stretch your feet. Well done. Now, left leg is up. 90 degree. Give a good rotation at your own pace. Carry on at your own pace, clockwise, anti-clockwise. Well done. You're doing very well. Okay, the next one is you do your cycling. Here also you are stretching quite a lot. Reverse gear. Other one. Stretch, stretch. That's the idea. Stretch. Stretch. You are on the bicycle. Lady bicycle. Come on. Reverse. Well done. Just relax now. Now come back on your tummy. Come back on your tummy. Stretch yourself. Stretch. Stretch yourself. Stretch. Complete stretch of the whole body. Stretch. Stretch. Take your mind to the calf muscles and the feet. They are the ones which are affected with the cramps. Stretch. Stretch. Then come back in the resting pose of Makaraksana. Spread your legs. Spread your legs. And take a couple of deep breaths in and out. Okay, the next one is first pose of Makaraksana, which is also going to give a lot of exercise on the calf muscles. Hands are like a stool underneath your chin. Raise your right leg up. Hold it. Hold it. Again, take your mind to your calf muscle and the feet. This is very good for the backache also. And for weight reduction. And good for the abdominal organs also. Get rid of constipation. Activation of all the organs of the tummy. The liver, the gallbladder, spleen, pancreas, intestine, kidneys. Bring it down because we have got problem of cirrhosis. fatty liver, which is giving me cramp. And diabetes giving me cramp. My neural system is not working, nerves are not functioning. As I said, peripheral neuritis. So diabetes getting better. The left leg is up. Try to bring close to your hip as far as you can go. No tension. Then take it down. If you are quite active, you can do with the both the feet coming towards your hip. Yeah. Squeezing your calf muscles. Then relax. I'm leaving Bhujangasana, that is for the upper part of the body. Though we stretch our legs, the next one is Shalabhasana. Lie down on your tummy. Take your hands underneath your thighs, because a lot of stretching done of the legs when we do this one. Chin is on the ground. Raise your right leg up. See how much stretch is coming on the lower limb. Take your mind to the calf muscle and request the calf muscle to get better. Please don't come at night to give me cramps. Thank you. Hold it as long you can do. Hold it. And you're getting other benefits also. Then take it down very slowly. Again, chin is on the ground. Raise your left leg up as far and stretch. 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 Stretching outside is the only answer. Stretch and massage. Then while breathing out, take it down. The second pose. Right arm at the waist. Raise the left arm up and raise the right leg up. Up, stretch. Stretch, whole body is getting the stretch. Good for sciatica, backache, and for my calf muscles. Stretch. Stretch. And breathe out, come down. Other side. Left arm is on the waist. Raise your right hand up and the left leg up. And stretch the leg. And my right arm also. Stretch. Breathe out and relax. The third pose, both the hands at my waist. And here I'm just going to raise my head and bring your hands down on your hip. See, head is only going up. Then breathe out and come down. Now the next one, we are going to raise both the head and the feet and giving full attention to my calf muscles and my feet. Breathe in. Hands are back on your waist. Breathe in. Go up both the sides and take your head down on your buttocks, because the arms are also stretching and the legs also. See? If you have little bit weight at your tummy, you're better off. अच्छा आधार बन जाता है. And you can stay for a long time. Maybe 2 minutes, 5 minutes, 10 minutes. See how much the legs are getting stretched. Very good. Carry on. Enjoy yourself. Now relax. Time doesn't permit. Relax again in the Makaraksana resting pose. Spread your legs. Spread your legs. Head on your hands. Take a couple of deep breaths in and out. Relax. Relax. We have to be in full relaxed, calm position before starting our pranayama. That is a must. My heart rate, my respirate should be normal. That is a basic principle for the pranayama. Relax, both physically and by mind, mentally. We have done lots of activation of whole body, which is suitable to sit for a long time in one position. Position is our asana. Any asana, while sitting on the chair, lying down on your bed or the sofa. Whatever your body allows you. You can sit on the mat, Siddhasana, Kamalasana, Padmasana, Half Padmasana, Sukhasana. So many poses. Vajrasana, which is very good for the digestive system. And this is the only asana which is allowed after the food. Now we are quite calm and peaceful. Now we can get up slowly. Well done. So you have done a lot of stretching, standing, lying down on your tummy, on your back. So we'll move further to our mudras and acupressure to make our problem better. As I said, you will be touching those things which is giving you problem. Like your fatty liver, cirrhosis liver, your thyroid gland, and the pancreas. Now we are feeling quite thirsty. So first we'll produce our own water. It's quite hot. And you've done a good job. Very good job. Yes? Clap for yourself. Always. Always be happy what we are doing. Yes? So we'll be doing now our pranayama. We have to do all the 8 steps of pranayama. They are all beneficial, all of them. But again, spending more time on Kapalbhati and Alom Vilom. We are the one. And Ujjayi Pranayama. Thyroid gland, parathyroid gland to be activated as it does with Kapalbhati. So 6th state, we are quite active now. Take a couple of deep breaths. Go on chanting inside. We have done Bajrika throughout our exercises. So we will now go over to Kapalbhati with all the precautions. Hypertensive heart problems, severe acidity, severe asthma, severe backache. Please do it slowly. If you are recovering from any ailment, do it slowly. And before you start doing, always consult your yoga teacher or your doctor, which one to do, because even after minor surgery, you have to be careful. If you are bleeding from anywhere, don't do it. Any headache, dizziness, vertigo, please don't do Kapalbhati. If you are pregnant or trying to get pregnant, don't do it. So we'll start with Kapalbhati. Now we want to activate our so many organs. And there are so many mudras and acupressure. Let's first start with our liver problem. As I said, cirrhosis is the one giving a lot of problem to the people. So we can start with Mandukasana, doing Kapalbhati. Okay? So start with Mandukasana. This is covering all our abdominal organs. So, thumb in, mutti band, keep it at the level of your umbilicus. Breathe in, breathe out, come down slowly. Look at the ground and lift your head up and look straight and do your Kapalbhati. You'll be doing 10 to 15 strokes as the day is getting warmer. And breathe in and come up very slowly. Now we want to activate our liver and the spleen at the same time. So this is there. Liver is on the right side, underneath the gallbladder. So put it like this and do Kapalbhati. And make sure the whole abdomen is moving. What else is happening? Kapalbhati is a detoxifying pranayama. Getting rid of all the toxins. Toxins from the brain. Anger, greed, enmity, ego. Sleeplessness, can't sleep. Worried. Getting bad dreams, getting scared. Then for the respiratory system, activating my liver, the spleen. Effect is coming to my pancreas and the thyroid gland, parathyroid gland, because I am suffering from underactive thyroid and my parathyroid gland is also not functioning, giving me cramps at night. Then put your hand, left hand at the Manipur chakra, right at the top. This will give effect to all the organs of your abdomen. Solar plexus, going to activate all the organs, going up to your reproductive system also. So breathe in, breathe out fully, come down. Please don't come down if you've got any back problem. Back problem is very common. You can sit straight and do it. If you've got back problem, otherwise you can come down and go on doing Kapalbhati. And try to concentrate on the problem, whether that is your pancreas not working, the liver, the gallbladder, the intestine, constipation. Another one, dehydration. Why we are dehydrated? We are constipated because of dehydration. No system works without water. Every system needs heat and water to function properly. Give a good smile on your face. Well done. Now come up. Again, breathe in. Raise your arms up. Stretch. And I'm stretching my legs also. Come on. Sitting on the chair. Stretch. Stretch your legs. Face the front of your feet towards my face. Come on. I am looking at the front part of my feet. Stretch. Stretch. Then go down slowly. Down. Take your feet back behind the place in between your chair. Take it back. Take it back. As far. Then breathe in again. We can do most of the exercise while on the chair, you know. Stretch. Stretch your legs. Stretch. Stretch. Hold. Stretch. Then breathe out and come down towards the ground. Take your legs right back. Right back. Go back. The other you can do with your feet, actually very easy. Very, very easy. Very easy. Anybody can do it. So these are my legs, you can see. Do like this. One, see, you are on your heel. You are on your heel. See, do like this. 1, 2, stretch, stretch the calf muscle. 3, stretch. 4, if you can't do standing, walking on your heel, you can do while sitting on the chair. We have lots of variation. We have to follow our body. We love our body. Carry on. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now this one. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Well done. Then do like this again, again. You don't have to stand up to do all these exercises. Do on the chair. Stretch, 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 stretch. This movement of feet is very important because sometimes you get cramps in your small muscle of your feet. Most commonest is your leg and leg only. Suddenly you get shooting pain as if something is going to burst. Then you get up or you're lying down, stretch the legs up as we have done 90 degree up in the air and do massage. If this persists and getting pain, you can do hot fermentation, put hot things on your legs, or if there is inflammation also, you can do ice pack compression. So these are the things you can do. If it persists for a long time, please go to your doctor, get the help. Because these cramps are not only that, there is some more serious disease behind it, as I mentioned. Kidney failure, liver failure, pancreas failure, thyroid failure, parathyroid failure. So they have to investigate you fully to make sure that you are not suffering from these serious diseases. Don't ignore if they last for a long time. If they come on and off, then you watch your diet, take a lot of green vegetables, and the things which contain calcium, potassium, magnesium, sodium. So you can watch your diet. Fasting, watch out for fasting. That can give you a lot of cramps. So rotation like this is also helping you. Carry on doing your own time, your own body. You can do all this while watching television, seeing the katha going on, so many kathas and so many good sessions are going on. Do with Swami Ramdev in the morning, 5 to 7:30, in the evening, 8 to 9. Asta channel, Sanskar channel, go on doing with him. With his presence, it's a blessing. It's a bliss experience with the Guru. So there we are, you've done quite a lot. Now we'll do some acupressure points also. Acupressure point, we are looking after our liver and pancreas. So Kapalbhati with acupressure. Now liver is on the right hand side, just at the first line here. Right hand, liver. So we'll go on pressing this point. Liver is there, gallbladder is there. So go on pressing, medium pressure. You go on doing Kapalbhati with acupressure of the liver point. Carry on. 1 stroke, 1 second. Give a nice smile on the face. God is so kind, giving us so much strength. Well done. Rub your hands again. Increase the circulation in the hand. We have done the liver point. Come to the pancreas point. You know we do this. That is touching so many organs. Acupressure of many organs. This one is coming down here. That is your adrenal, that area. And stomach area also there is. And then this one is your, which one? Middle of the palm is your kidney point. When we do like this even. Third ring finger is touching the area where you use pancreas. So that comes roughly here. This point. So go on pressing this point. For pancreas, to get better with diabetes, Kapalbhati, added benefits. Next one is your thyroid point, which in the area here, this raised area at the base of your thumb. This is all your thyroid, parathyroid, and your throat also. So we press it like this because it's a big area with 2 or 3 fingers, acupressure. We are thinking about our thyroid, parathyroid gland doing Kapalbhati, because when they don't work, these glands, we get cramps. Both the hands, there are 2 glands. Thyroid is 2 lobes. Parathyroid got small 4 lobes. If you are getting cramps, check what medicine you are taking. Sometimes it is caused by the medicines we are taking, and most of us are taking those medicines. The commonest one is for your high blood pressure, diuretics. We are losing water with all the electrolytes, and we are getting cramps. Then the statin, we are taking the fat-lowering drug, statin. They are also giving you cramps. And many other. For indigestion, we are taking. Cimetidine, we are taking. That is also. And many more. So please, if you are taking these medicine, if you are getting cramp, whatever medicine you are taking, because we don't know about everything. So go to your doctor and ask him, doctor, maybe I'm getting cramps because of my medicine. This is very common. Go and ask him. I know many people have stopped statin because of this. Don't stop any medicine. Consult your doctor before. Always go to your doctor. Discuss with him. You have a full right to discuss your condition. So please make appointment. Go to your doctor if you're suffering from cramps. So you have done your thyroid point. Now we want to make our kidneys better. So you can do this pinky at the top. That controls your kidney and the water also. So you can press this nicely. Press it. Acupressure. Both the side. Go on doing Kapalbhati with this. Or if you want, you can do Bhadrika. If you're feeling tired, do Bhadrika. Now produce more water in your body. Whatever you do, acupressure, always come back to the kidney point, which is in the middle of the palm. Press this one, so that whatever toxin is released, they will be taken out from the body, from your urine. As we are doing pranayama side by side, Kapalbhati or Bhadrika, we are throwing the toxin from our respiration. That's why we encourage you to do pranayama all the time, because that is the first and the foremost. If you can't do anything else, just do pranayama. Pranayama, carry on. Both the hands for the kidney. Well done. You're doing very well. The next, coming to your mudras, We are doing every day. I am dehydrated. I want more water. I can do pranayama also for that. Shitli and Chitkari, but I am doing first my mudra. So do this Varan mudra for dehydration. No water in my body. So Kapalbhati with Varan mudra. Jal Bhagwan ki jai. Varan Devta ki jai. Next, you can do your Prana Mudra. That's a good flow of my prana up and down and good for the eyesight also. Dehydration is causing a lot of eye problem also. The cataract, glaucoma, dryness of eyes, not drinking enough water. Eyes are affected. So do this Prana Mudra with the Kapalbhati. Then you can do Apan Mudra also. Take away the toxins and you can move your body also. Get activated more. Your neck, your chest, good for my heart and lungs, my arms, my neck. No time to do all those exercises. So I'm covering everything by moving my body. Kapalbhati with a Pan Mudra. Get rid of toxin, produce pour more water. So the next one we will do our Ujjayi Pranayama because I want to activate my thyroid gland, parathyroid gland, plus lose weight also, increase my metabolism and my speech also getting better. I can sing loudly, clearly. So let's do Ujjayi only twice, please. Hands are in, put it in your Varan Mudra because I want to produce more water. Squeeze your neck muscles, breathe in from the nostril, the sound will be produced like snoring sound. This is good for snoring also. We call it anti-snoring pranayama. And the pranayama for the musicians, singers. Breathe in. And bring your chin close to the chest if there is no neck ache, holding your breath. How long to hold depends on your practice. Don't hold it if you're suffering from breathlessness or heart problem, hypertension. No, don't do it even. Don't do it. Then straighten your chin, close your right nostril, exhale from the left. This is your Ujjayi Pranayama, which is very, very beneficial. Many, many benefits are coming with this. Glow on your face also. Good for sinusitis, eye problem, nose problem, ear problem even. The next one is Alom Vilom. Try to do this for a long time. Take away all your stress. All your stress. Activation of all the nerves, all the blood vessels. So once they are working, you might not get that night cramps, because water is coming, balancing of all the hormones. Okay, time doesn't permit. The next one, I want to produce more water. I don't want to get these cramps. I'm doing a session. The teacher says you can't drink the water. So I want to produce my own water from my own body. Shitli and Shitkari Pranayama. Take your tongue and breathe in from the mouth. And close your lips, exhale from the nostril. This is a very cooling effect. Cooling effect going from your throat, the esophagus, the stomach. Very good for people suffering from acid reflux also. Hyperacidity, various other problems. This was your Sheetli. Name is Sheetli. Sheetal. Sheetal. Thanda. The next one is Sheetkari. See. Too much chilies in your food. Burning my throat. This is very good for your gums, for your teeth, for the buccal cavity, and various other benefits on the face. I call them all these anti-wrinkling. The face yoga is happening, face yoga. Get rid of all the wrinkles. And if you have started early, we wouldn't have any wrinkles. Never mind. Never too late.
Repeat it.
Hmm?
Please repeat the Sheetkali.
Sheetkari is giving more benefit because of the teeth and the gums. Gum problem, tongue problem, buccal cavity. We get a lot of ulcers nowadays, aren't we? Most of us are getting ulcer on and off. Never ignore your ulcer. If the ulcer lasts more than 3 weeks, go and consult your doctor.
How to do
this
it?
is very important. People who don't drink water, they got a lot of problem in the mouth even. Dryness, they can't talk even. Difficulty in eating and talking even. So watch out all this. Enough water is taken in the body. So this is Sheetli and Sheetkari to increase water to get rid of my cramps. Yes. And then the next one is very soothing. Other thing is which you can increase, time doesn't permit. Try to increase the exercises of nitric oxide because they are going to dilate my blood vessels. So my function will be much better in every area of the body. That covers the whole body. You do this nitric oxide humming and exercises and try to eat the vegetable and the fruit which contain more nitrate because nitrates are converted into nitric oxide. We have covered this subject many times in detail. So please look out what you are eating. Green vegetable, lots of fruit, vegetable, nuts, all the pulses, and take always unsaturated fat so that you're not getting obesity, diabetes, hypertension. We have mentioned all those. Look at the food you are eating. Is there enough calcium? Is there enough potassium? Is there enough sodium, magnesium, and various other nutrients? So please watch out. So the next pranayam, our Bhamri pranayam, very good for sleeplessness. That is the next topic, most probably. As people had asked, the guess was wrong though. Their guess was wrong. They guessed it was sleeplessness. Okay, carry on. We do 3 times Bhamri. Next, Ujjayi Pranayama. Hands are in Dhyan Mudra. Take a long deep breath through the nostril, chanting the word Om from the mouth 3 times. Om. Om. Prana Pranayama, the 8 steps. Prana means Om, the supreme power. Fix your mind either on your breath or any chakra of the body. Go on chanting inside, the silent meditation. Any name, any dhun, any bhajan you are doing inside. Think of the divine, the cosmic power. And we are in the state of gratitude also. So I will do in Hindi today. मैं अकेला नहीं हूँ. Repeat in yourself. Again and again. मैं अकेला नहीं हूँ. मैं अकेला नहीं हूँ. वो सर्वशक्तिमान सदैव मेरे साथ है. उन्हीं की अपार कृपा से ये सब कुछ हो रहा है. आपका बहुत बहुत धन्यवाद प्रभु जी. आपका बहुत बहुत धन्यवाद जिन्होंने हमें इतनी शक्ति प्रदान की आज के योग अभ्यास की. बड़े प्यार के साथ धन्यवाद धन्यवाद धन्यवाद. Raise your arms up, rub your palms, put the palm on your eyes, slowly open your eyes and remove that. The next is laughter yoga, which is very, very important. What is the physiology behind this laughter yoga? I will cover this one day. Very important. What is happening? We are laughing and laughing and laughing. Day and night, laughing, laughing. To increase our immunity. Be happy, cheerful. Produce good hormones. Good antibodies to fight any type of infection. Come on. Weight reduction. Good for the heart and the lungs. And for constipation also. When you are doing laughter yoga. Yes. Come on. The next one is your Singasana. Very important. Open up completely all the sinuses. Good for eyes and ears. And the throat. We do only twice. Well done. We are all line or line. Sarve bhavantu sukhina. Sarve santu niramaya. Sarve bhadrani pashantu ma kaschit dukha bhag bhavet. Om Purnamidam Purnat Purnamudachyate Purnasya Purnamadaye Purnameva Vishishyate. Hari Om Tat Sat. Hari Om Tat Sat. Hari Om Tat Sat. Om Shanti Shanti Shanti. Okay, my friends, thank you very much.
Thank you,
This is
Dr.
Dr. Kapoor.
No more